So the question with health literacy is what are you actually going to use? What are your vehicles? So these are radios, good example of radios through the ages. But of course, this is really the modern radio right now. A lot of us listen. Wisconsin Public Radio has a wonderful Dynamite app, and that's where radio is going. Radio will never disappear. But I had trouble getting a transistor radio. They're not transistors, because they don't even sell them in Target anymore. I had to buy it online. But of course, I can get an iPad anywhere. Television, this is television the way, of course, it was. And of course, this is the way TV is right now. And if you looked at the Wall Street Journal or the New York Times, it may be that broadcast TV is now going to go through the web. It is going through the web, and there's a fight over content. We look at books, that's my book. PBS, I was obviously younger with more hair. Newspapers, that's just my column. Posters, WPA poster. Lack of funds need not discourage from seeking competent medical care. Lack of funds. In other words, are you going to get incompetent medical care from lack of funds? It's just a WPA poster. But this, of course, with health literacy in WPA. Cancer is curable. Fight it with knowledge. I wish that were true. I wish we could just fight cancer with knowledge. I don't know what's happening to figure out what they're doing there. Okay. Yep. Figure that out in 1 week. We'll get rid of dismiss. Dismiss all. Yes. Don't you love it? Don't you love it? We've all gone through that at one time or another. I worked with the Dalai Lama's doctor, Dr. Seton, and he was giving a lecture in Chicago. And I arrived an hour before the lecture, and he said, "Why are you arriving so early?" I said, "Audio-visual. Something always happens." And he said, "This is America. I thought that only happens in India." Not at all. Not at all. Now, this is no longer working. So whatever you did with that, you have to fix this, because this is no longer, sorry, and that's stuck. So 7 years ago, our fathers brought forth on this continent a new nation, conceived in liberty and dedicated to the proposition that all men and women are created equal. Anyway, the slides, if we are able to actually get to them and get to, there we go. Is that going to work now? Wait until the next glitch that goes through. This is my favorite. As old as creation, syphilis is not curable. That's why the dinosaurs died. They died from syphilis. Really, really. It was syphilis. They were having sex all the time, and they weren't protecting themselves with a dino condom. And we're not doing it. Can you imagine the size? Yes, you can imagine the size. How about this one? John is not really dull. He may only need his eyes examined. But I mean, this is an example of health literacy. Look at John and look at that teacher who's really angry with his work. Websites, podcasts, of course, and social media, which has become more and more important. Social media. You may be a native, you may be an immigrant. Immigrant and native to social media. So just a bit about technology, which I think is important. I was in Spain, unfortunately, several years ago, sitting at a bar listening to Ben Sidran with my wife, and we had to visit our child who was there, and we had to go to Spain not once, but twice. You know, what a shame. And I'm sitting next to a bunch of Brits who are there to teach the Spanish teachers how to teach computer science. And we were talking about things, and they said they divide people into immigrants and natives when it comes to computers. And at that time, an immigrant, this was a couple of years ago, is somebody over the age of 30, and a native is somebody under the age of 30, brought up with it. And so it was a very good concept. And I said, well, I'm way over 30, but I really like computers. And they said, when did you start learning it? And I said, well, when I was 16, when I went down to the Illinois Institute of Technology. And so he said, well, you're a native. When we look at social media, it's the same thing. I had to go to somebody 20 to learn how to tweet, because the 26-year-olds don't necessarily know how to tweet. And this media is very, very important. But if we look at things like Facebook, we're all on Facebook now because it's become so easy to use. Texting, if you go to Dr. Zorba, I texted yesterday, it's going to be more and more important as a social media that we're going to be used to be able to tell our patients about health literacy. So what do they all have in common? They have content, they have attention span issues, language issues, a whole bunch of other things that I think are important as you're crafting your message. As you're crafting your message, because I craft messages in columns, in books, on blogs, on the web, in radio, in TV. They all have different attention spans, and if you don't pay attention to the attention spans, you won't get there, because effective communication is how you do things, both in an emotive way and in a technical way of what you actually want to get across. Because dull communication sucks. And I'm going to give an example. So you look at the list thing on the right. I mean, it's a list, you're not going to look at it. Your eye immediately goes to the boy who would be a helicopter. In other words, because it's much more interesting to our eyes. What's interesting to us, what's info-educational entertainment, infotainment, is the stuff that's going to hit home that people are going to remember. And there's something called the peak end rule that we'll get to. If you think about what you remember about Byron yesterday, think about in your mind what you remember about what you said. There's certain things I remember. I remember the teacher who stopped him in the hall and said, "Why are you suffering?" That's what I remember. I don't remember much before that. It was a peak experience, a very peak issue in my mind. And that's the way it is with health education information. So let's get into the nuts and bolts of what I think are some tips. And then what I want to do then is get down beneath